just waiting for our guests as well as speakers to come and join. Again, we're going to have our interim superintendent, Dr. McKnight, and MCPS staff, and a representative from the Department of Health and Human Services join us tonight. So, if those people are watching, I would appreciate if we could have a request. We'll wait for those to come in. So, I hope everyone's well. Happy Wednesday. I hope you enjoyed your house day. In addition to the calendar. Again, Dr. McKnight or Department of Health or MCPS.
Great to see all of you this evening. Some of you, if there are any Northwest students on here, prior to July 1st, I was the principal of Northwest High School for the past 5 years. I want to start out by wishing a very happy birthday to our amazing SMOB, Hana Looney. Happy birthday.
Thank you, Mr. DeAndrea. I appreciate that. Thank you
for
so
spending
much.
Your birthday with us. Thank you for spending your birthday with us.
Of course. Of course. All right. Any word from Dr. McKnight or our Department of Health? Are they having trouble?
No, we are working to get them in as we speak.
Okay. Cool. Do you want to take some questions in the meantime as we wait for them to come in?
We definitely can. Let me check. I just texted just to see where we stand. So
cool. So yeah, Mr. DeAndrea used to be the principal of Northwest High School, so it's nice to have him here. We appreciate the work that he does for the system.
DHHS is getting a message that says request not sent when they click on it.
Okay. That is difficult.
Technical challenges.
I know. So I know everyone, for your information while we're waiting, Dr. McKnight as well as the DHHS, the Department of Health, they just did another community conversation mostly aimed at parents, community members on Zoom. So it's been a long time for everyone. Long day for everyone. That's what I meant to say. Cool.
Why don't we give another minute or so and then we can jump right in if we're still having technical challenges. I know that Dr. McKnight is working right now to get on.
Cool.
She loves being with meeting with students. So this is something she
I know.
particularly likes to do. Obviously, we all know that technology can be a challenge sometimes.
Yes. Yes, I do want to say, everyone, I would appreciate if we kept the content of our chat school appropriate. I hope that that's not a reminder that I have to repeat often throughout tonight, but I really hope that we can keep everything appropriate, and I will only be uplifting questions and answering ones that are appropriate. So just
and thank you for mentioning that, because we record this and we want to be able to have the recording available for people to watch afterward. But if there are not school appropriate comments, then unfortunately we can't use the recording. So thank you to everybody for keeping that in mind.
Yes. Yes.
So why don't we can go ahead and go ahead.
Let's get started. So I think one of the most popular questions that I got, I think it's important that we look forward to the future, and I want to focus most of tonight's conversation on that. But people do have a lot of questions about last week. MCPS started off by saying that we were going to be monitoring COVID-19 cases when a school reached a 5% staff and student population threshold. The Department of Health would start an investigation to possibly bring that school to virtual learning. A few days later, the school system came out with a communication saying that that 5% threshold was not going to be part of that process to deciding to move an individual school into virtual learning in the future. Can you talk a little bit about why that decision was made?
Absolutely, and I know that's a question on a lot of students as well as community members' minds. So as we started to work with the Omicron variant and realized that cases were increasing very rapidly, we worked very closely with the Montgomery County Department of Health and Human Services to determine how we were going to evaluate schools. Because at the end of the day, safety of students and staff is our top priority in all of our 209 schools. And so we collaborated with the Department of Health and Human Services. And ultimately, that 5% threshold is how the state of Maryland defines an outbreak of COVID-19 in a school. And so the decision was made at the time to be able to use that to also evaluate possible consideration for a transition to virtual learning of an individual school. As some of you may have seen on social media, late last week, the state weighed in on that and said that while that is the definition of an outbreak, that should not be used for determining if a school should transition to virtual learning or even to initiate discussions around that. So as a result, we sent the updated communication on Friday saying that we would not be using that metric by itself, but it is important to note that we are looking at each school on a case-by-case basis to evaluate a variety of factors to determine if we need to consider a transition to virtual learning. So for example, we're closely monitoring each day the number of staff who are absent, and when we look at teachers, we're looking at the number of substitute jobs that are unfilled where a substitute didn't pick up the position, and that means that other staff in the building ultimately then have to cover the class. We're also looking at student absence rates. We know that coronavirus cases have increased very dramatically here, throughout the state, and throughout the country, and so that's a really important factor as well. We're also taking into account, and I imagine there'll be some questions about this later, but the issues around transportation. Montgomery County, along with a number of other schools, are really struggling with having enough bus drivers, because as bus drivers get sick, there's not a pool of bus drivers available to tap into. As you may recall, at the beginning of the year, we started the year short approximately 100 bus drivers just because of the huge need that there was. So with all that being said, those are just some of the factors that we take into account. And I believe Dr. McKnight may be coming in right now as we speak. So this would be great timing.
I see her coming in. I just accepted the request. So,
excellent. I know she's very excited.
She should be coming in shortly whenever the connection is made. Hello, Dr. McKnight. Can you see and hear us?
I can hear you, and it still says connecting. Can you hear me?
We can hear you. It looks like you're having maybe some connectivity issues. Okay, I see you. Hi.
Yes. We made it.
How are you doing, Dr. McKnight? I know it's been a long day.
Good to be here, Hana. Thank you for inviting me, and thank you to the team who was just helping to make sure we can figure this out. So I am here.
Of course.
And we're so excited that Hana's spending her birthday evening with us, celebrating tonight on Instagram Live.
Yes, I
Of
would
course.
just sing under normal circumstances, but since I'm sick, let's not do that. But happy birthday, Hana.
Thank you, Dr. McKnight. So, Mr. DeAndre and I were just talking about the removal of the 5% threshold as a consideration for moving an individual school to virtual last week. I'm getting a lot of questions from students. Does that mean we're not looking at COVID anymore? Does that mean we're not counting cases? Are we not counting cases daily? What's happening with that?
Thanks for that question, Hana. So first to our students, absolutely, we have to continue to look at what the case rates are, because that tells us the story of exactly what's happening within your individual schools, how many people have been impacted by COVID-19, have positive cases, and that helps us then determine what we're going to do. We moved away from the threshold because we needed some flexibility in looking at different situations. We recognize it just wasn't, COVID is not the only variable that we need to look at when we consider whether a school needs to go virtual or not. So that's just one part of the puzzle. But yes, we are collecting data. We're continuing to monitor it. And yes, it is important.
Okay. I'm getting a lot of concerns from students. They're looking at the case numbers. They saw, right, when we published the numbers, that their school was above 5%, maybe approaching 10%, but they're still operating in person. What would you say to a student who has that concern?
So I'd like to say that students, when we came, and we talked a little bit about that tonight in the community conversation, and hopefully you were there and could hear this, but we made that decision in collaboration with DHHS because we were using guidance from Maryland Department of Health that described a school outbreak. Now, with that said, this terminology, these definitions have been developed since, we've started managing COVID-19. What we were dealing with and how we define safety prior to the vaccine being provided is very different. So I just want to say, yes, you absolutely are going to be, the safety of you and your condition within a school is very important to us. And so we're going to continue to look at those case rates, but know that the state corrected us and told us we should not be defining an outbreak in a school to determine if that what makes it unsafe or unsafe to the point in which we need to switch to virtual. So when we got that information, we corrected it. But I don't want any of our students to question whether we value their safety or not in the process. No, we just corrected a decision that we made that actually we made in error, and we wanted to make sure we fix that quickly.
And if I can jump in, Hana, as well, just to talk about, there are a lot of different safety measures that we have put in place as a school district, but I did want to just highlight a couple of those that are upgrades as we move into January and February. First of all, as many students already know, we're in the process of purchasing KN95 masks for all students and staff, so that all students and staff have the opportunity to wear masks that are better in terms of protection than traditional cloth masks or the surgical mask that we had before. The other thing is, as students are probably aware, all students in the past few days should have gotten rapid test kits to take home and administer at home, and then we've asked students to submit their results. Increasing testing is a critical way that we help to keep schools safe, because that enables us to identify where there are cases where students may not have symptoms that we wouldn't know about otherwise. And if a student doesn't have symptoms, that doesn't mean if they test positive that they're not spreading the virus to others. So the mask and the testing are two upgrades that we've just implemented very recently. So I just wanted to highlight those to build on what Dr. McKnight shared.
Yeah,
I think
appreciate
the DHHS representative may be coming in.
Yes, I am accepting their request as we speak, and I think they're connecting.
Oh, excellent.
I did just want to, since you mentioned the tests, is that going to be a regular process, right? Because testing just measures positivity at one point in time. So.
That's an excellent question. The rapid tests do just provide a snapshot at that individual point. We are working with the Department of Health and Human Services to be able to increase the amount of rapid test kits that we have so that we are able to do that on a more consistent basis. So we don't have all the details on that yet, but the Department of Health and Human Services gave MCPS 190,000 test kits for this first round of testing for all students and staff, and we will have more information in the coming days about the plans moving forward. But it looks like we have another guest who joined us.
Yes. Hi. Could you introduce yourself?
Hi, I'm Mark Hodge. I'm the acting Senior Administrator for School Health Services in the Department of Health and Human Services.
I appreciate your time on this weekday evening, Mr. Hodge.
Thank you.
So I'm going to throw a question your way,
Okay.
Which is one that a lot of students have about just generally being concerned that schools are a COVID hotspot, a place where a lot of transmission is happening. Could you talk about transmission levels of COVID-19 in schools?
Sure. So, as I'm sure everyone has seen and heard on the news and everywhere else, the level of COVID in our community in general is really high right now. This particular variant, Omicron, is extremely contagious, much more so than any of the previous versions of COVID that have been out there. And while it is creating much milder symptoms, especially for those who are vaccinated, it is still more infectious. And so we are seeing that across the community, across the U.S. We are seeing millions of new cases across the U.S. every single day. And that MCPS and Montgomery County are not immune from that. So we're also seeing much higher levels of that in the community than we've seen before. So we are doing lots of testing. We're doing lots of immunizations to get those up to date for our students across the county. All the things we need to do to be able to mitigate the spread of that to keep people healthy.
I appreciate that. Could you talk about, with all the mitigation that we have in place, is spread of coronavirus in schools a concern? Are schools a place where a lot of spread has been shown?
So we haven't had a whole lot of school days since Omicron showed up, but we certainly are seeing the spread of the virus in the school, but it does not seem to be any higher than it does in the general community, the spread at least. And so people are much closer proximity in schools, certainly, but wearing masks makes a huge difference. There's a lot of concern about when the students take their masks off at lunchtime. They're in close proximity at lunch. They are taking their masks off so they can eat, which makes complete sense. But that is when they're most at risk of transferring the virus for those who are already positive. By doing the testing, by sending the test home, we are hoping to catch the students with positive COVID before coming to school. And so that will help prevent it as well. Those sorts of things are the things we can do to stop the spread. But we're not seeing any increase in schools compared to other parts of the county or even other parts of the U.S.
Okay, I appreciate that response. And Dr. McKnight, with what Mr. Hodge just said about increased spread in the community, and then also the concern about lunchtime, what are some steps that MCPS has taken to combat that in our school?
For our students, for you all, I just want you to understand, when we make decisions with you in mind. And one of the most recent decisions that we made was, although we were adopting the CDC guidance that moved the isolation and quarantine to 5 days, we did not change that for students. And we didn't change it for students, and we still have the isolation and quarantine at 10 days because we know, students, we know that you're in close contact when you're in cafeterias, when you can't wear your mask, when you're eating. And so we have to take that into consideration. And so that was one very important and purposeful step that we made and decision that we made, which was to keep the student isolation and quarantine 10 days as a result of that.
I appreciate that. I've been getting a lot of questions about that, right? People asking about why are staff able to return back to work in 5 days, which of course is the new CDC recommendation, whereas we're keeping students at 10 days. And it really is because we're taking that lunch, that increased risk into consideration. So a lot of our students, especially at the secondary level, which I hope all of our students who are on Instagram at least right now are, they've been following the news, seeing what other school systems are doing, and I'll particularly talk about the case of Prince George's County, our neighbor right next door, which did a 2-week closure, and they're returning to school, I believe, this upcoming week. So really, any and all of you, could you talk about why MCPS has not decided to do a system-wide closure?
Yes, so I'll start there, Hana. So students, I know that you are always watching what's happening. You all are watching what's happening in Montgomery County, what's happening everywhere else. And every place has its own story. Not that there's a different level of commitment to what we're all trying to do, but there are always very different circumstances. So when we think about what we need to do in Montgomery County Public Schools, we're looking at what's happening within our community. So what does transmission and spread look like in Montgomery County? And then what does that look like based on the data that we have in schools? And so we make those decisions based on those data points and many other circumstances, just as Prince George's County did. And I will tell you, one thing you all should know about COVID is there's something different all the time that's happening. And so we have to be able to figure out what's happening, what is the situation we're trying to assess. And before we make a very impactful decision for our students, we want to have all the information, because we want to do two things: make sure you're receiving an education in a way that's valuable to you, but we, as you've said, we want to keep you safe. And so we did make a decision to continue. Now, last week, I saw the messages. You all were very excited. We ended up being out of school for 2 days related to weather, unexpected, and then, a delay. And so that was absolutely a period in which we were not together. But we used that time to really plan and make sure that when you did come back to school, it was important for us to put those tests in your hands so that you could utilize them and we can get the data back from you as soon as possible so that we are able to make those informed decisions. So we depend on you, and we need your help, students, with that. And I just want to say it's so many factors involved in this. And just because one school system makes a decision to do something, it doesn't automatically apply to us. But we want to be transparent. That's why we're here having this conversation with you tonight, to at least help you understand what are some considerations we take, we bring into our conversations when we decide how we're moving forward.
I appreciate that. And I did say at the beginning of the conversation with Mr. DeAndrea that I wanted this to be a forward-facing conversation talking about plans for the future, what students should expect. We are not doing a system-wide closure. We've committed to doing individual school closures. What is that process going to look like? Who is making those decisions, right? What factors are being considered?
Yes, that's a great clarification question. So I will equate it to almost a snow day. Who makes the decision when a school or schools must be closed? And that's me, and I do that with collaboration and information that I receive from others, and then share that information with the board based on the best interest of whatever the situation is or the circumstance that we're dealing with. So in thinking about a process, yes, if we need to close an individual school or a group of schools or whatever it may be under the circumstances, we want to share with you, as well as your parents and our staff, what are the conditions around that? And that's something we're still talking about. We've been having conversations, or we were participating in conversations before about, well, what's necessary when we're looking at only COVID-19 data. But let's be real. There are a number of other things that are happening that we have to take into consideration. Was it just a few weeks ago on Hana when we had our student forum? And I heard from students who said, we are in buildings and many of the staff members are not there. And someone described it in some sense of, it's almost like you're not sure who to expect because so many people are being out with COVID. And the student was speaking on behalf of peers and staff. So that's another factor that we have to take into consideration. This past week, when we were unable to have all of our students transported to schools on buses, well, then that presents yet another problem. So the decision making really will involve, what are those factors that get in the way of us operating as a school that we have to look at, and then a recommendation based on all of those factors, and the conditions of those factors will come to me, and then I will make that decision. But that's very important when I say the information comes to me, because there will be things that I'll want to know, students, how many staff are in the building? How many buses were unable to bring students to school so that they can't receive an education? Those are just really important pieces. Do we have cafeteria staff there that can provide meals in the school when students are there? So those are the questions that I'll ask and the information that I'll need to be able to make an informed decision. And if we have to move to virtual, when there are specific circumstances impacting the school, the good news is we know what that looks like and we know what to do, because we've had to do it for much longer than we anticipated.
And who is making those decisions ultimately about individual school closures?
So we have not we have not shared that plan yet. I will ask
Okay.
our students to tune in. You all should tune in when we have that conversation. It will be a discussion or information coming out about that process and outlining that specifically. So I'm going to say stay tuned on that so that you can get that information first. And then if we need to hop back on a Instagram live to have a discussion about that process to make sure you understand what it is, then let's do it.
All right, sounds like a plan. Might have to hold you to that. So it sounds like, just to recap for our students, just to recap for our students who are watching, the factors that are going to be taken into consideration are, yes, COVID cases and where those cases are coming from, right? As well as where our staff shortages are, because I've seen from experience in my school building, I've had a lot of subs recently. I know a lot of schools, including my own, when there's not enough coverage, a lot of students are being sent to the auditorium or the lunchroom to be covered by staff who are available. So I have also received questions from, yes.
There's a delay, and I apologize for that. I think there's some type of delay, but I heard what you said, and I wanted to emphasize that that's not what we want. We don't want you all to come to school and go to a multi-purpose room and spend your day there, or to spend a couple of periods there. That's not what we desire in the experience that we want you to have in our schools. And so that's an example, again, of information that we have to know and be aware of and really determine exactly what that is, because that could be the case at one school, but at another school that may not be impacted in the same way, and the staff is there. Maybe there are 2 or 3 people who were unable to come into work, maybe functioning fully. And so I just pause because it's a great example of why we have to look at each school on a case-by-case basis, because the circumstances are different. Yes, it would be easy, I would imagine, if it were of value to say, okay, we're all just going to shut down. But again, and I know many of them are probably not on this Instagram live. I hope not our kindergartners, first, second, and third graders. But let's acknowledge the fact that when they come to school, it's a very different experience. And if there's anything that we can do to protect them, having that quality experience, as well as you. But we just know that there's different circumstances in that. But we have to consider all of that when we make those decisions, and we want to be very purposeful about it. So you just said that, and I wanted to emphasize that point, because I know many of you have, or you may have younger sisters or brothers or siblings in the school system, or any family members, and if they're at home with you, you know the attention that they need and deserve, and it's no different in the school day.
Thank you for that response, Dr. McKnight. So in MCPS, we have 209 school facilities, and 11 of them are currently virtual. When can we expect to hear about other schools possibly transitioning to a virtual environment?
Well, I mentioned earlier we're having conversations and meeting with staff this week, so that we are trying to be very purposeful about trying to wrap this up this week so that we know what it looks like going into next week. We know that the Omicron variant is here. We've seen from trends in New York and other places that there's a wave that tends to calm down within just a few weeks. But I feel like, next week will still be a big learning space for us. So we're trying our best to have those discussions and be clear on the process this week so that we can communicate with you and our community as quickly as possible.
Okay. All right. So sounds like this week is still planning, and then we'll hear more in the future. I've heard a lot from students who are concerned. Maybe they are immunocompromised or they live with someone who is, and they're feeling concerned about attending school. If a student decides to stay home due to concerns about COVID, not necessarily contracting them themselves, is that a lawful absence?
So when students are not in school, we are expected to report it as an absence, unless it is an excused absence. Now, students, you all know that if there is something that is a situation that you need to share with your school, the process of going through and submitting for an excuse for an absence, I mean, I ask people to utilize that process and that procedure as appropriate. I do understand wanting to take care of yourselves and your family. Every household is different. And if there is someone in your home that is immune compromised in some way, yes, I'm sure every time you walk out of your home, you are thinking about that, because you know what it means when you come back in, and what it could mean for that person who is compromised in that way. So I understand, and we are being very thoughtful about that, and we're also looking to put some information out to share some options of exactly how we can help our students work through that. I know the virtual academy was one example of that. Of course, our virtual academy, we have to work with the state and have the state approve the number of students that we have in that program. And so that's one avenue that we've been working with, but we also hear you and recognize that there are specific areas and unique situations and circumstances that we need to account for. And so we are working through some options and having some discussions about that. And again, I'd like for you to tune in. More information to come very soon about that.
Yes, I know that's something I'm certainly interested in. For full transparency, providing students who don't feel comfortable attending school some sort of virtual option to be able to still participate in education. I think that's really important. So it's been a very stressful week, past 2 weeks for all of you, I'm sure, but also our students and our staff. What is MCPS doing to support student and staff mental health during this time?
Yeah, we talked about that, I believe, in our last Instagram Live, Hana, and it continues to be a focus for us. So for our students, I mean, you all know and you've expressed to us repeatedly, the stressors that have come with even returning back to school and having a full day schedule this year has been very different from experiences in the past, because you had to readjust to not only going to all of your classes, adjusting back to processes, but also participating in extracurricular activities. And so we have provided, we're providing more staff in the schools to be able to support. We heard our students the other week say that we need our counselors to be more available to us to have those conversations, and we need them to be able to be equipped to have those conversations. And so we are working with our counselors to help them understand the needs that you've expressed and the availability that you expressed that you need from them to be able to and support you in ways that are important and that you've expressed. We continue to think about how we look at our processes, grades and all of those things that could very well cause stress in a way that students are still adjusting during this pandemic, and really working with our staff to say, where do we need to have some exceptions, or how do we continue to work with you as you determine, what are the things that get in the way of you being successful academically. If you need more time, more support to be successful as you transition back into a more structured schedule this year, how can we provide that? So those are just a few that I can think of. Mr. DeAndrea, anything I may have missed?
Thank you, Dr. McKnight. I think the other piece that I would add as we think about the supports for students is to really, at each school, there are resources available. And we talked about, the counselors in particular. The counselor is a really good entry point for a student, so to be able to go and talk to someone, talk about the feelings that you're experiencing, and then they can help, make connections with other people in the building or other resources within different schools, because all of our schools have a variety of resources set up to help provide supports to students. The other thing is, we know that all of our staff are working incredibly hard to be able to support students and to support our schools. And at the end of the day, staff care very much about students. So while the counselors are one possible entry point, I definitely encourage students to reach out to any of your teachers or other staff members in the school to be able to talk to and share things that are on your mind. Because at the end of the day, like I said, everybody's working incredibly hard. All the staff care very deeply about you and want to see you be successful and have the support that you need. And as a system, that is, a top priority for us. I mentioned at the beginning, we were talking about your safety. We think about your safety not only from the physical perspective when we think about coronavirus, but also your safety of your social, emotional well-being and health in school buildings.
Yes, that trusted adult, very important.
Definitely. And even today, right? I know staff and student workload is something we've been very sensitive to throughout the entire year, not just now, as with this rise in COVID-19 cases. The reason why today was a half day, it was not originally planned to be at the beginning of the school year, but we're adjusting, we're making decisions as the school year progresses. We added 3 additional half days to help address that. So I appreciate that. So unlike the Zoom webinar, I know the 3 of you were just on a few minutes ago, our audience during this Instagram Live is fluctuating a bit. So I do want to toss it back over to our Department of Health and Human Services again for a moment. Just if you could give your professional medical opinion on the safety of students in in-person school during this time. Hopefully you can give our students some reassurance.
Sure. So we have a lot of mitigating opportunities for this. I mentioned before masks, wearing masks, tight, secure masks, not over your mouth and nose, not loose fitting masks. Testing is really going to be important. People who are having symptoms, and right now Omicron seems to be having a lot of cold and allergy type symptoms, which can be a little confusing. A lot of people have these symptoms every single winter. This time it happens to be Omicron overwhelmingly when you're having a runny nose or a cough. And so not going to school when you're not feeling well. Making sure we do all of those things so we can prevent the spread when they're in school. There is spread in the community. There is spread in school. The only way to prevent that is for everybody in the world to stay home in a bubble, and that's just not possible for us to do. We need to use the measures we have, the things I just mentioned, the masks and social distancing and washing your hands, all those things to prevent the spread, knowing that that we can't prevent that.
Yeah, and I know Montgomery County Public Schools, we are the 14th largest school system in the nation. So something we often like to do is what we call benchmark with other large districts. And we like to see what other districts are doing and steal ideas from them. Can anyone speak to what other school districts have sort of pointed to as a solution to this national rise in cases, what we've learned from studying other districts?
Absolutely. Oh, go ahead, Dr. Manning.
I was going to say, I'm so glad you asked that question, because that's what we have been doing. We have been spending our time looking at all of the school systems across the nation, and particularly looking at ones that are similar in size to Montgomery County, to look at what they are doing and what measures they're putting in place to keep their students safe and to be able to operate. Mr. DeAndrea, who was a forefront in doing that research, you want to share with them some of what we have found or learned?
Absolutely. Thank you very much for that question, because it is really important to know that we are looking at other school systems, especially other large school systems. So just to give a couple examples to start with, we work very closely with the other large school systems in Maryland and collaborate with them and share ideas about how we can best support students, and first and foremost, make sure that our schools are as safe as possible for all students and staff. And so earlier this year, there were a lot of conversations with other school systems in Maryland around how we were going to be handling testing. And so as a result, in Montgomery County, we rolled out one of the largest testing programs of any school system. And our testing program started out with 2 components, and we added a 3rd component. We started out by offering rapid tests in school health rooms for any students that develop symptoms during the day. We also added the opportunity for all students to participate in random screening testing 1 day each week at each of our 209 schools. Now, it's a random sample of students. All students can sign up, and we strongly encourage all students to sign up for that as part of our Say Yes to the Test campaign. And then, as we talked about earlier this evening, we now have these rapid test kits that you all have gotten earlier this week. And this is a 3rd component of our testing program, and that's a direct result from hearing what other school systems are doing and how they are helping the students and staff to remain safe. Because one of the things that we know is we don't have the ability to go into each of our schools and be able to do testing for every single student and staff member every week. But we can provide testing resources for students and staff to take home and be able to administer the test themselves. And that's a great way for us to help in keeping schools safe. We also have looked very closely at other school systems around the country to see what are the decisions they are making in terms of deciding whether or not to transition to virtual learning. And there are a number of school systems around the country that don't put a lot of specifics into that, because at the end of the day, they want the decision to be made on a case-by-case basis, looking at each school individually and uniquely. We recognize here in MCPS, we have 209 schools. Each school is different and has unique needs. And so in collaborating with these other school systems and really benchmarking with them, we've seen the way that they take a very individualized approach in many cases to making those decisions. And this goes back to what Dr. McKnight shared earlier. We're going to be having this conversation more later this week, and there'll be more information coming out. But at the end of the day, we know that it's not a one-size-fits-all approach in terms of that decision when we're considering about whether a school needs to transition to a virtual learning environment for a designated period of time. So these are just a couple of the ways that we've been benchmarking with other school systems, but that is something that we do on an ongoing basis as we reflect on how we can best serve all of the students and staff in our community.
I appreciate that response. So just to summarize, when we're benchmarking with other large school districts across the nation, we're not seeing a lot of system-wide closures. We're really seeing an individual approach with our large systems.
Absolutely. If you look at the majority of the very large school systems, we'll say the 25 largest school systems in the country, the large majority are open as a school system, and some of the school systems are looking at schools individually and making decisions to transition to virtual learning for individual schools for a period of time. But there are also a number of large school systems that have said they're not going to transition any schools to virtual learning. They're looking at other measures to be able to keep schools open for in-person learning.
Yes, and I think across the nation, what we're really seeing is a real interest in keeping in-person learning as much as possible, because every school official has been studying the impacts of virtual learning on our students, and we're seeing that it's really having a disproportionate impact on the students that we know have been historically disadvantaged for so long. So students of color and low-income students. So even Prince George's County, everyone's favorite example, they're returning back to in-person learning after the 2 weeks. So that's just something I wanted to point out. Sorry, Mr. DeAndrea, were you trying to say something?
No, I was just going to add on, that's not just something here in the Metro DC area as well. There's a focus, our state superintendent has talked about the importance of in-person learning. The Secretary of Education for the United States has talked about the importance of in-person learning. So it's a conversation that's happening throughout the United States, but there's a large focus everywhere on this. And that's why I just want to highlight at the state level and the national level how that is something that's being continually discussed in terms of how we can have in-person learning safely for students.
Especially when we're trying to correct 1.5 years of so much learning loss. We know the best way to be able to do that is really in the classroom. So I appreciate that larger national perspective that we're getting. Can I just ask, do we have a hard cutoff at 9, or can we go until 9:15?
I'm okay.
Yes, I'm fine.
We're good. Awesome. All right, we're going to keep going. I'm going to take some questions from the question box. Someone is asking, why has MCPS stopped positive the active case count on the COVID dashboard? I think I'm going to task that to Mr. DeAndrea.
Yes, I can respond to that. So we started last week on school days posting the number of cases each day in each of our schools, broken down by students and staff. That information today, we had some technical challenges, so the information has not been updated today, but every other school day, we do have the data for the number of students and staff that reported testing positive for that particular school day starting last week. And that was a response to questions from community members and students in particular, wanting to have a better sense about individual school information on a daily basis as opposed to a weekly basis on the current dashboard that we had. So that information we will be adding back as soon as that technical issue is resolved. But I actually just found out about that during the town hall meeting we had previous to this Instagram Live, that we're having some technical challenges. So the data for today is not posted, but for all the other school days, going back to last Wednesday, it is there.
I appreciate that response. All right, I'm going to pull up another question. Did MCPS officials happen to see the petition signed by over 10,000 students for schools to go virtual?
Yes, we have seen that petition, and we definitely always, appreciate student advocacy, and I know that it's not just students who have signed the petition, but also other community members. And anytime that we receive those kinds of pieces of information, we always, take those into consideration and really take the time to really read and digest that information as part of our larger decision-making process. So as I shared at the beginning of this, prior to this position, 6 months ago, I was a high school principal, and student advocacy is very important to me. And I know that is as well to Dr. McKnight, who was also previously a principal. So we appreciate the students who initiated that effort and really take, the information that you share with us into the larger discussions around next steps.
And I'd also like to add that just alone that our students felt that they needed to sign a petition to say, hey, there's something that we're concerned about, signals to us that it's really important to you. And so earlier we were discussing, we are taking some of our these variables into consideration. And I committed to saying we would be back in touch and communicating with you, because if you've signed a petition saying this is important to me, I want to bring it to your attention, then it's as important for us to make sure we're coming back and communicating with you so that you understand the process. And most importantly, you understand why we have made the decisions that we've made and how it truly is with you in mind for all the things that we value about the experience we want you to have in Montgomery County Public Schools.
Yeah, and I think something that this has really shown for me is I think there's a lot of fear in our community right now, and a lot of that is outside of MCPS's control. So for our students who are feeling fearful about attending school, which I really just feel horrible about, honestly, what would you say to that student?
I have one response that I'll say first is, if you are eligible to be vaccinated, get vaccinated. Mm-hmm. That's the first step and the most important step we can all take to help us navigate throughout this pandemic. I have COVID-19 right now, but I'm able to be on Instagram Live with you and having a discussion because I have been vaccinated, I have been boosted, and so it does, quite frankly, feel like flu and cold. I would imagine if I was not vaccinated and I did not get my booster, it may be more impactful to me. But I didn't want to figure that out, nor did I want to take the chance. And so I say to our students, that's the first step that you can take to help protect yourself and others so that we don't have to live in an environment of fear and wondering what's going to happen next. But we're doing everything to protect ourselves. I don't know if anyone else wanted to add, any other perspectives, but the vaccination is key right now.
Absolutely. I'll just chime in briefly and say, we definitely respect, how students feel. And, we are taking every possible step that we can to do everything possible to keep schools safe for students and staff. And we encourage, going back to what we had talked about earlier, we would definitely encourage you to reach out to staff at your school, your counselors or others to have a conversation about, all the different measures that the schools are putting in place to help make sure that students and staff are safe.
Right. I've seen a couple of comments about breakthrough cases, and so I kind of want to address that too. Yes, the people who have been vaccinated, even have had the boosters, are still getting COVID. I'm one example of that, but it doesn't mean that the symptoms from the virus were bad. If you look at who's being hospitalized right now across the country, it is the significant number of people who have been unvaccinated who are being hospitalized with Omicron at this point. It's not the people who are vaccinated. Yes, people who are vaccinated can still get COVID, especially the Omicron variant, but they're not as sick as those who are unvaccinated. They're not likely to spread it as quickly as people who are unvaccinated. The vaccinated people in our country are not the ones overwhelming the healthcare system right now. It continues to be the unvaccinated. And so, yes, while there are breakthrough infections, it's still really important to get the vaccine to prevent serious illness.
I appreciate that response. So another question that I got is about extracurricular activities, which I believe the 18th is the date that those are resuming in person. Can we talk a little bit about the logic behind that decision?
Absolutely. I can chime in on that, and Mr. Hodge may want to share as well. So prior to winter break, we are regularly collaborating with the Department of Health and Human Services on really a daily basis on the steps that we take to keep schools safe. And one of the recommendations that the Department of Health and Human Services brought to us prior to winter break was that we really needed to take some steps with our extracurricular activities to help mitigate the increase in cases that we were seeing in December. So as a result, in-person extracurricular activities were temporarily paused beginning December 20th through the end of this past week, the 7th, and then ultimately we put out more information on Sunday saying that they could resume starting on January 18th after we distributed the rapid test kits. And as part of that, DHHS has stated that all the students participating in in-person extracurricular activities need to take that rapid test and then share with their sponsor the results of that rapid test before they resume participating in the in-person extracurricular activities. It is important to note for any of the activities, just like with athletic activities that may involve spectators, no spectators are allowed when the activities resume on the 18th. And again, that's another safety measure that's been put in place to try to minimize the number of people coming into the school for events when the activities resume.
All right, can you all hear me?
Yeah.
Okay, perfect. I think I'm having a little bit of trouble, but I'm gonna ask my next question anyway. More broadly speaking, I think things just feel very different for students. And what I mean for that is in March 2020, we heard about COVID-19 for the first time, many of us. We saw a rise in cases, and the school system's first instinct, the Department of Health's, I think, first instinct at guidance was close the schools down for 2 weeks. Let's stop the spread. Let's close things down. Now we're seeing a similar rise in cases, but we're in January 2022, and we're seeing a very different approach. School systems across the nation are trying their best to stay open and put in mitigating procedures. Why is the approach so different this time around?
Dodge may be best to answer this question, but I will say, being here and experiencing what we all experienced in March of 2020, it was different because we did not know all the things that we now know about COVID almost 2 years later. We did not have a vaccine at that time. We were learning. We were learning, and everyone was learning at the same time. And so, yes, there was a decision that was made by our state officials to close because we really didn't know the scope of the problem. Well, now we've learned. We have learned a lot about the virus. Yes, there are new variants that continue to come. And so when that happens, then that's when we make decisions and try to figure out how do we change the rules of the game, or how do we change the rules applying to our processes and procedures as it relates to all of that. And we make those changes and we share that with you all so that you can understand what are the conditions in which we are working to help keep you safe, but to still operate. I don't think any of us desire to go back to a time in which we did in March 2020, which is when we were isolated in our homes for a very long period of time. And right now we're talking about the context of school, but we couldn't go out to restaurants, couldn't go out to movie theaters, we couldn't do anything. And if we don't know better how to navigate this 2 years from now, 2 years from when that happened to where we are now, then that says we really have not taken the time to do what we need to do to make adjustments to live in this new normal. And so now that we are living in a new normal, when we know more, we're better informed, we have a vaccine, then we have to adjust our processes. So with that said, I do understand why we made the decision, or the decision that was made for us to close schools in March of 2020. But now here in 2022, there's a different message saying that we need to learn the lessons and figure out the best way to operate, but operate safely.
Thank you for that response, Dr. McKnight. I'd also like to hear from Dr. Hodge from the Department of Health perspective. What has changed between March 2020 and January 2022? Why is the approach, the guidance that we seem to be getting so different?
So Dr. McKnight was completely correct. That we did not know all of the things that we know now. So 2 years ago, this was a brand new virus. It was people were dying, people were being very sick, people were being placed on ventilators. We didn't know what was happening, and we didn't know how to stop it. And so closing down schools, closing down restaurants, closing down governments, sending people home. The number of people teleworking now is so much higher than it was even 2 years ago. So doing all those things in an effort to make sure that we prevent the spread as best as possible, not knowing anything about this particular virus. Since that time, we're now on our 4th different variant. While Delta seemed to be pretty strong, this current Omicron variant is fairly weak at least in the side effects or the symptoms that it causes. And so knowing that we now have vaccines, we did not have vaccines 2 years ago. And since we've gotten vaccines, especially in Montgomery County, where we have a very high rate of vaccination, the number of people who are being severely ill, being hospitalized, or even dying has dropped dramatically because of our vaccination rates, because of the type of symptoms this particular variant causes. And so as a result, we're able to make educated decisions this time about what is happening and what we think we can do to mitigate the spread, or to at least decrease the spread of this particular virus at this time, without having to close down everything the way we did in the past.
Yeah, I think, at least to me, from my perspective, it really feels like, COVID-19 is called COVID-19 because 2019 is when it was discovered. We're now in 2022. It's year 3. It really just feels like this is going to be a permanent fixture of our lives. And we need to figure out how to keep going. We need to figure out how to keep our kids educated and keep things moving. And I think that's really my perspective. All right, so it's 9:12. I'm going to be shut down very, very soon. I wonder if Dr. McKnight, you have any closing words for our students, a last message that you hope to give.
Yes, thank you, Hana. First, I want to thank you all for coming on and participating in this conversation. I know there's a lot happening, and I know that you do want to know what are the things that we're doing as a school system to take your thoughts and suggestions and recommendations and concerns into consideration. And that's why we're here having this conversation tonight. I do want to say to you, let's continue to have these conversations. Let's discuss the things, even if we don't agree about what the decision is. I think it's important for us to still spend the time talking about it so that you understand. And even if you don't understand why the decision is made what it is, you at least have all of the information that we took into consideration around why those decisions were what they were. And we do that because we respect you. We would not have a school system if we did not have students in our school system. And we do care. And I hope that you do know that, you feel that, and that you continue to share recommendations and suggestions with us and with the staff that you are with every single day of how we can continue to grow and connect. Tonight on the community conversation forum, it was about how do we do this together, even when we don't agree, but how do we continue to interact in an environment where we are supporting one another and, most importantly, trying to care for one another as a community. And so I thank our students for being a part of that community.
Yes, I want to thank all of you for your time tonight. I know it's been a long day and a long 2 weeks. So taking your time out on a Friday night to speak to students really means a lot. I think transparency is important, right? I know last week did not go as smoothly as it can been and what it should have been for our community. And I appreciate Dr. McKnight, the statements that have gone out about that. And I think moving forward, our school system has a commitment to being transparent, open with our community, providing all of the information we can as much as possible. But please also, students and families, remember that there are real people making these decisions. And we have feelings too. And we have mental health we need to take care of soon. And we are really trying to do everything with the best interest of all of our community members in mind. So with that, thank you again for your time and have a great rest of your evening.
Thank you, everyone.
Thank you.
Thank you. Have a good night.